One question I get asked a lot is, which technique is best, clean or sterile? So there's advantages to each, but typically we're going to ask the question of where the patient is doing the catheterization. If they're at a hospital and there's an increased risk for getting a UTI, then we're going to want to use likely a sterile technique. But at home, a clean technique is actually fine. All of the recent evidence-based practice articles are showing that there's not an increased risk that patients have for UTI when they're doing a clean technique versus sterile if they are doing it at the home environment. But if someone else is going to be assisting them with catheterization, then obviously there's that increased risk, and we're going to want to make sure we do that sterile technique, don sterile gloves, use the betadine swabs just to reduce that risk of infection. But again, clean versus sterile is going to depend a lot on where the patient is doing the cathing and also if they are at an increased risk for UTIs. If they don't have really a high risk of UTI, clean is fine.